Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Welcome to the Dr. R Show. I'm here with Dr. Kevin Connor. Dr. Connor was the former director of stroke at Texas Health Arlington. Thanks, Kevin, for being on the show.
Thanks, Jay.
We're here today to talk about stroke. You're a neurologist, so before we get on to stroke, what it is and all that, what does it take to become a neurologist? What's your education, training, and background?
So I did medical school like we all had to do, and then I did internship in general medicine, and then 3 years of neurology residency, and then spent another year doing some neurophysiology at UT Southwestern. And
stroke is something that a neurologist takes care of a fair amount.
Correct.
Yeah. So tell us about stroke. What is a stroke?
So stroke is a sudden neurological event. It's a event that just changes you as far as strength, as far as speech, as far as vision. But the key is stroke. It's like a stroke in time. It's just suddenly, all of a sudden you have something that's not working the way it was supposed to work before.
And how common is it?
It's actually pretty common. So we estimate that about almost 800,000 folks a year will have a stroke in the United States. So it's one of the more common entities that a neurologist will actually see.
And what causes a stroke?
Stroke is caused by several different things. The most common thing is basically a kind of plug in the pipe, if you will. And so there's a problem with blood flow to brain tissue. And once that blood flow stops, within about 4 minutes or so, brain tissue starts to die. And that's when you start having neurological symptoms.
So that's an ischemic stroke.
That's an ischemic
there
stroke.
Are other kind of strokes?
So there are other kind of strokes. So ischemic is 85% of what you do, and then there's what's called a hemorrhagic stroke. And a hemorrhagic stroke is where the blood vessel breaks, basically, and it bleeds into the brain tissue itself. So it can bleed from outside in, and sometimes it can bleed from directly into the tissue out.
So there's a condition known as TIA. Could you tell us what the difference between TIA and a stroke?
So TIA means transient, which means it's temporary, ischemia, which means a lack of blood flow, and an attack. And so that's what the stroke is, part of that. So TIAs, by definition, the neurological symptoms go away within 24 hours. What we're learning now, though, with some of the imaging techniques is, in fact, that's probably not a good definition anymore, because a lot of TIAs are probably little strokes that have clinically gotten better, but we still see some damage.
So what causes a blood vessel to clot off? What causes a thrombotic stroke?
So a thrombotic stroke can be related to plaque, so kind of cholesterol glue or goo that deposits within the wall of the blood vessel. It can fracture, and you can have these things called platelets that stick to the wall of the blood vessel, and it's basically calcium in the pipes. And so it just locks everything up, and anything beyond that's not getting the blood flow. It's not getting the water it needs anymore, and then it dies. It can also come from other places, so like from the heart. So if you have something called atrial fibrillation, it can break a piece of clot off, and that can travel downstream. The piece is bigger than the hose, blocks it up, and lo and behold, you have a stroke.
And what are some of the signs and symptoms of a stroke?
So they vary. The signs and symptoms are depending upon which blood vessel actually gets closed. So it can be a little blood vessel that goes to the back of the eye, and all of a sudden it's like a little shade being pulled down. It's called amaurosis that develops. Or it can be to a speech center, where all of a sudden you start talking like in a foreign language, or you don't understand, you can't comprehend what's going on. Or you can suddenly have a facial droop, or an arm can go weak or heavy and become limp, or numb and tingle that's developed suddenly.
And is there a way to recognize a stroke early on?
So the American Heart Association has come out with a mnemonic that's really, really easy for most people to use, and it's called FAST. So F is for facial involvement, so it's the facial droop that some people will get with stroke. There's the arm weakness, that's the A part of that. There's the speech difficulties that you can get. And the most important thing is time, meaning for us, when did it happen? For the patient is get to the hospital, okay? time is brain, and that's a way to be able to preserve brain tissue.
And the way to shorten that time to treatment, the first part is, of course, recognition. You have to know, did a stroke happen?
Absolutely.
So educating the public is important because they may not recognize
that
what they're seeing as a stroke.
Correct.
Are there any efforts to do that?
There are efforts to do that, and so part of when we do stroke certification for specific hospitals, part of what we are required to do is to go out and actually do educational programs, so try to get that information out there. They had a thing at the ballpark, actually, that was part of stroke education as well, and so that's a good part of it. But also community service and the education ads that are out there also seem to help as well.
And so what can be done to shorten the time to treatment?
What we know is that if you call 911, you're more likely to be treated quicker than if you just kind of lazy-daisically kind of just drive yourself to the hospital. So that's one thing that can be done. Recognition is really important, so especially in men, because men tend to ignore symptoms a lot, and so, and I've had patients that have just suddenly had their arm go weak and decided they're going to go to bed and see if it got better the next morning. So recognizing that, hey, this is not a normal thing, and hey, there is something we can do about it. Let's go to the hospital, let's get it checked out, because time is really, really critical for what we can intervene on.
Now, are seizures common with stroke? Is that one of the presenting signs or symptoms?
It can be sometimes more with a hemorrhagic stroke, because blood is an irritant in the brain itself, and so you're more likely to see a seizure as a result of that. But typically, no, seizures are not a big initial presentation of a stroke.
Now, how common are seizures after a stroke, once you've gotten over it?
They can. It depends upon where in the brain the stroke occurred, but they can occur about 10 to 15% of the time after strokes in particular areas of the brain. So sometimes we do have to put patients on medication to try to prevent seizures from developing.
We're going to take a quick commercial break, and we'll be right back.